Each year, over 250,000 women in the United States are diagnosed with breast cancer. But early detection and advances in treatment have saved many lives. There are more than 3 million breast cancer survivors across the nation. The physicians on this segment will discuss the risk factors, diagnoses, and newest treatments. First up is radiologist Dr. Marla Lander.
Breast cancer is a progressive disease, meaning that it's not born huge, aggressive, it hasn't already spread throughout the body. It mutates and changes as it has time to grow.
Dr. Lily Wang reveals some of the risk factors for breast cancer.
The number one risk factor is being a woman. The second risk factor is age. The older we get, the more likely one is to develop breast cancer. Breastfeeding, whether or not you breastfed your children, whether or not you had delivered or had your kids before the age 40, alcohol, smoking, genetic factors.
If you have a first-degree relative that's had breast cancer, father, mother, and I say father, while breast cancer is rare in males, it does occur. 1% of all breast cancers are diagnosed in males. If you have a sister, a daughter, your risk of getting breast cancer doubles. If you have 2 first-degree relatives, your risk goes up by 3 to 4%. And if you've had a personal history, by the way, your risk is that much higher than the general population. There's much more of a chance that you will get a second cancer than that somebody walking down the street will be diagnosed with their first. If there's no family history of breast cancer, that doesn't mean you don't have to come for a mammogram or that you don't need to be concerned about it, because only 15% of breast cancers have a familial association.
Dr. Wang lists possible symptoms of breast cancer.
Vast majority of breast cancers that we find and detect have absolutely no symptoms. They're found through the screening mammogram. The remaining breast cancers that we find, in terms of symptoms the patient would feel, they may feel a change in their breast, a lump, a hardening somewhere in their breast tissue, something that wasn't there before, something that's growing. This is the most common sign. Another sign is a bloody nipple discharge.
Breast surgeon Dr. Courtney Vito tells us lumps in the breast need to be investigated.
The lumps that concern us are the lumps that grow, the lumps that change, or the lumps that cause the skin to pull in, the nipple to pull in, nipple drainage. Things like that is more what we're worried about. And so when we look at these lumps, again, in women under the age of 30, very few of these lumps are cancer, but these may be lumps that going forward you need to know are there to help you detect a cancer that may develop in the future.
There is not just one disease called breast cancer.
There's over 25 different types of breast cancers, and they can present very differently. How they appear, how they act, how they might infiltrate tissue or push tissue around. Some of them might be visible only on the mammogram, others on ultrasound, some by MRI and some by a combination. So you have this, what we call heterogeneity of breast cancers, but in addition to that, not every woman's normal breast looks the same on imaging either. There's all kinds of different patterns and different densities in the breast. Another obstacle in the way of detection is that sometimes cancers can mimic benign lesions in the breast, such as cysts or benign tumors.
Imaging has become a life-saving tool for breast cancer detection.
There are many ways to detect breast cancer. One way is by palpation, and that is by feeling the breast, whether it be by your physician or the patient herself finding a new lump. That's one way. With that, though, we would then follow with additional testing. That is mammogram, can evaluate the breast, looking for breast cancer. If further testing is needed, sometimes an ultrasound is necessary to take a look at problems within the breast tissue to find these breast cancers. Also, in a very small subset of patients, we can also utilize breast MRI.
And in the mammograms also, there are some film mammograms, digital mammograms, and recently we have this 3D mammography or tomosynthesis. The advantage of that is it can detect what the mammograms cannot detect. 30% of the time the mammograms may not be able to detect some lumps, but this 3D mammography can detect it. It picks up cancers or the lesions much more accurately. Some cancer cells, they need female hormone like estrogen and progesterone for them to grow. If that is the case, we call them they are hormone sensitive cancers. And these are the types of cancers we can treat them by blocking those estrogens, by giving anti-estrogen medications. The attractive thing about this is these are all pills and the side effects are very minimal. Most of them, they won't have any hair loss or won't have the side effects of like chemotherapy.
Dr. Vito highlights the differences between women who are diagnosed with breast cancer and their survival rates.
It's not just the risk of developing a breast cancer itself. It's not necessarily the incidence of breast cancer that we're concerned about, but we're also looking at the mortality from breast cancers. That can break down along socioeconomic lines, racial lines, and other inheritance patterns. You may see somebody that has a small but aggressive tumor whose survival is not estimated to be the same. So when we look at incidence of breast cancer, that's just one small number. And really what we should be looking at is the overall survival and the morbidity as well as the mortality. Morbidity meaning the side effects from treatment.
Oncologist Dr. Swarna Chanduri emphasizes the importance of early detection.
If we detect the cancer very early as a stage 1 cancer, that means when the cancer is just confined to the breast itself and didn't spread anywhere, we can, with the proper treatment, almost like 95% of the women can be saved.
What are the recommendations of screening for breast cancer?
Several years ago, the U.S. Preventative Task Force Services recommended increasing the age of screening to begin at the age of 50 instead of the age of 40. They also talked about tailoring based on your own personal risk, whether you'd have an annual mammogram or a biannual mammogram. I really think that it's appropriate in some women to tailor their mammography and when it starts, but that tailoring must be done between a patient and a physician, taking into a variety of risk factors, including their breast density, their family history, their ability to safely perform clinical exams, meaning that there's a reliable clinical exam that's not obscured by lumps and bumps. And I think mammography is a wonderful tool. It's the only modality that we have that can reliably diagnose breast cancer when it's stage 0, the only time that breast cancer is considered 100% curable. Mammograms certainly have their value. They certainly have their downside as well, and that's why every woman needs to consider carefully all of her risk factors with her and her doctor before making that final decision.
Dr. Lander gives us some final advice.
As you age, that's one of the main risk factors other than being female is getting older. So as you age, it's much more likely that you might be diagnosed with breast cancer, not less likely. So women, keep coming for your mammograms. As you get older, do yourself that favor. Let us find it early when it's a minimal surgery, and then you're done. You go on with your life. And hopefully you never get diagnosed.